Good afternoon, everyone. Welcome to today's update on COVID-19. With us, as always, is Dr. Dina Hinshaw, the Chief Medical Officer of Health for Alberta. Dr. Hinshaw will provide a brief update, and then we'll open the floor for questions.
Thank you, Tom, and good afternoon, everyone. Before I begin today, I want to talk about a troubling issue that has come to my attention. I have received reports that some Siksika First Nation members were recently denied access to local businesses as a result of recent cases being reported in their community. This is not the first time that we have heard such reports around COVID-19. I know that Albertans of Chinese or other ethnic heritage and some religious groups have also at times been singled out and discriminated against. COVID-19 doesn't care where people come from or what a person's heritage may be. The virus is not restricted to any particular race, region, or community. In the case of the Siksika First Nation, leadership in that community have acted quickly, transparently, and proactively to control spread of the virus. When the result of that prompt and transparent action is stigma against their members, it sends a message against transparency and risks discouraging people from being tested or cooperating with public health. The members of the Siksika First Nation deserve better than that. All Albertans of every heritage deserve better than that. The communities and facilities that publicly report cases are all working closely with health officials to limit the spread of COVID-19 and to protect public health. Anyone who contracts the virus deserves our compassion and support to work with public health. That is the only way we can control the spread of this virus. Now to today's update. I am pleased to report that 8,048 Albertans have now recovered from COVID-19. Currently, 55 people are in hospital, of which 13 are in intensive care. We conducted almost 6,000 new tests yesterday and have identified 86 additional cases in the province. Today, we have also added Wheatland County to the province's watch list. Alberta now has 4 regions coded in blue for watch status. We are monitoring these regions closely, and no additional health measures are being implemented at this time. I am sad to have to report an additional 2 new deaths, including one linked to the outbreak at the Misericordia Hospital. My heart goes out to all those who have lost loved ones during this time, whether to COVID-19 or any other cause. I know that many are concerned about the outbreak at the Misericordia. This outbreak currently has a total of 49 cases, with 17 active patient cases in hospital and 17 staff cases which are currently active. Sadly, there have now been 6 deaths associated with this outbreak. There are multiple measures in place to keep staff and patients safe, and an evaluation of how the spread happened is underway, so we can be sure to learn and apply any lessons from this experience. This is a challenging time for any public health response. The virus has now been in Alberta for 4 months, and while we saw cases decline from the peak seen in April, our daily cases have begun to rise over the past few days. Much of the public advice that we have been providing, including regularly washing your hands and physical distancing, has been repeated for months now. This pandemic has been a long haul, and I worry that Albertans may be starting to tune the messages out. It can seem like old news, and many are tired of hearing this information. As the Premier and I both mentioned yesterday, we are concerned about the recent rise in cases we are seeing. Also of concern is the younger age of people infected with the virus. Over the past 2 weeks, 780 new cases have been identified in the province, with 57% of these cases being under the age of 40. Of these, 30% have not yet been linked to any known source. This is a reminder that COVID-19 can spread quickly, and cases can rise rapidly if we don't all do our part. The best way to defeat the virus has not changed. Stay 2 meters apart when you can, and wear a mask when you can't. Wash or sanitize your hands. Stay home if you are sick and get tested. It's also critical to respect the limits for cohorts. A maximum of 15 people outside of your household for family members and friends. up to 50 for sports cohorts and performers, which are cast members and crew. It is also important to remember that sports cohorts of up to 50 people should not interact with other cohorts. Now is not the time to plan or arrange tournaments that include players outside a single cohort. We need to avoid overcrowding in public spaces and social gatherings. That's how we keep our families and communities safe, by following the guidance, not by discriminating against fellow Albertans who also are doing their best to follow public health measures. It is natural to feel a bit of COVID-19 fatigue. If anyone is tired of following the public health guidance or feels that they are not at risk, please remember that your actions are protecting more than yourself. Anyone can become ill from this virus, but older Albertans and those with heart disease, diabetes, or other underlying medical conditions are at the highest risk of experiencing severe health outcomes. To date, 148 of the 161 deaths reported in Alberta were individuals over the age of 70. Almost 90% of those who died from COVID-19 had 2 or more underlying conditions. Every one of us acts as a shield that protects our friends, families, and neighbors from this virus. By taking simple, everyday actions, we can help limit the spread, particularly to those most at risk of severe outcomes from COVID-19. Every time we step out the door, we should all ask ourselves, who am I protecting today? We all need to continue respecting each other and working together to keep everyone safe and healthy. Thank you, and I'd be happy to take any questions.
All right, we'll go to the phone now. In addition to Dr. Hinshaw, we also have Dr. David Seekin, Edmonton's own medical director, available to answer questions on the Misericordia. Operator, could you put through the first caller, please?
Our first question comes from James Keller of the Globe and Mail. Your line is open.
Hi there. This is a question for Dr. Hinshaw. Are you aware of any links between cases in Alberta and a recent spike in infection in Saskatchewan? And specifically, are you looking at outbreaks and travel between Hutterite colonies in both provinces and how this might be affecting new cases?
We have been working with the Hatarian Safety Council and with Saskatchewan, just like any other part of our community. The Hutterite community is not spared from exposure or transmission, and so some of our new cases have been linked to Saskatchewan. But again, I would repeat that while we are seeing some of these linked cases, we also just received reports of several cases and close contacts linked to house parties in BC, where many young people were gathering together, partying in different people's houses, and going out to nightclubs without observing proper social distancing. So I will repeat my earlier assertion that it is critical that we not single out any one particular segment of society, but rather understand that we all need to be working together to follow the public health guidance to stop transmission.
Operator, can you put through the next question, please?
Our next question comes from Michael King of Global News. Your line is open.
Hi, Dr. Hinshaw. Just wondering where we're at when it comes to testing wait times, like actually getting an appointment. What are the wait times in the different zones right now in Calgary? And then also, are there any outbreaks at Calgary restaurants, hearing potentially one downtown?
The specifics of the exact wait time would vary across the province. We can get that information from AHS with respect to the wait times depending on location. With respect to an outbreak in a restaurant, I'm just looking at my list of outbreaks. I don't have one specifically listed here, but that's again something we can take back and look into. But I'm not currently aware of an outbreak in a restaurant in Calgary.
Operator, can you put through the next question, please?
Our next question comes from Julia Wong of Global News. Your line is open.
Hi, Dr. Hinshaw. First, just a quick clarification. How many cases are connected to the Good Samaritan Southgate, and how many of those are in patients, how many are in staff? And for those cases that are travel-related, are they coming from people who are coming from abroad or from within the country? Manitoba just reported a case that involved an individual who flew to and back from Calgary, so hoping to get your thoughts on that as well.
I don't actually have the current number of cases in Good Samaritan Southgate. So that's going to be something we'll follow up on and get back to you with the breakdown of staff and residents. Oh, sorry, I do have it. 14 cases, 7 active cases, and 6 have recovered. And there's now 1 death associated with that outbreak. Unfortunately, I don't have the breakdown between staff and residents, so we will have to follow up on that piece. With respect to travel-associated cases, what we do on our dashboard is we do provide the number of cases linked to travel. Typically, that would be travel outside the country, so I don't have the specifics of how many we've had in the recent days off the top of my head, but that should be available on our public-facing dashboard with a breakdown of travel-related cases. And if it's only done as an aggregate, we can look into that and get you a recent summary of the last few days and which cases have been linked to travel. As I mentioned earlier, certainly as there has been some movement between provinces back and forth, we have seen some cases that have been exposed in other provinces. Other provinces have reported seeing some cases that were exposed here. And we are working closely with all of our provincial colleagues whenever an exposure like that happens to make sure that appropriate follow-up happens, just like we would if we had a local case that was exposed in Alberta.
Operator, can you put through the next caller, please?
Our next question comes from Sarah Ryan of Global News. Your line is open.
Hi, Dr. Hinshaw. So we're talking about more people getting infected. We need to avoid crowding. Yet Phase 2 lifted any restrictions on gathering sizes in restaurants and bars. So we're wondering if there's going to be any new restrictions for fans that would be gathering to watch NHL playoff games. And if not, or if so, who will be enforcing social distancing as fans gather?
So I want to be really clear about the expectations for bars and restaurants, which is that distancing between tables would remain in place. So each table can have no more than 4 people at it, and tables need to be 2 meters or more apart from each other. So while there's no maximum number of people that can be present in a given location, there still are requirements for distancing between tables. And again, that maximum number of people who are going to be at any one table, it is our recommendation that people who are going to restaurants together and sitting at the same table who are not distanced from each other would be members of the same household or cohort family. With respect to any additional restrictions for people who are gathering to watch NHL games, the same restrictions would apply. Again, 4 per table, 2 meters between tables, and while there again is no maximum number of people, it's the distancing between those small groupings of 4 per table that continues to apply.
Operator, can you put through the next caller, please?
Our next question comes from Lauren Kruel of the Canadian Press. Your line is open.
Oh, hi, good afternoon. Now that some time has passed, I'm just wondering if there's been any evidence of any COVID cases linked to those anti-racism marches that were taking place in recent weeks and months.
We have seen a small number of cases who potentially acquired the infection at the rallies. We also identified a small number of cases who potentially were infectious while they were present at the rallies. We have not seen significant numbers, so the case numbers that I'm aware of are less than 10, but I don't have the firm tally in front of me, so we'll have to get back to you about that. But certainly we did see that there was some transmission that took place likely in those events, as is not surprising given the number of people that were gathered. However, given that there were a large proportion of people who were wearing masks, that I think that the outcome could have been much worse if some of those precautionary measures were not taken.
Operator, can you put through the next one, please?
Our next question comes from Adrienne Williams of CBC French. Your line is open.
Hi. I have 2 questions if we have time. My first question would be about the fact that the United Nurses of Alberta is calling on the government of Alberta to immediately implement mandatory wearing of face masks. So I wanted to know what you thought of that. And I also saw that a company is offering antibody testing you have to pay to get them, and also I wanted to know what you thought about this initiative.
With respect to the letter from the United Nurses of Alberta, I did receive a letter today from that organization, which I will be taking into account and reading. The current provincial policy is, as I think we're all aware, that masking is not mandatory. However, it is strongly encouraged, particularly when people are in public places, when they're within 2 meters of those who are outside their household, especially in indoor places and crowded places. So we are encouraging that, also supporting it by providing free masks to all Albertans, which was announced yesterday. And so our current policy is, again, to provide recommendation and support, but at the current time it is not mandatory. With respect to the second question, it's important if Albertans are considering purchasing a private pay test, whether it's an antibody test or another test, to do some research on the credentials of the lab that's offering it and what the accuracy of that particular test is. If they do choose to pay for an antibody test, it's really important to remember that we don't yet know whether an antibody test will mean that that person has a level of immunity or not. We're not sure how a positive antibody test would correlate with immunity to COVID. We also don't know how long antibodies last. And any test is not going to be 100% specific or sensitive. So again, Albertans who choose to pay for that test would just need to know the limitations of it. And it's really critical that if they do have a positive test, that they understand that test does not mean that they are immune, and that test does not mean that they are safe to put themselves in harm's way or at risk of exposure to COVID.
All right, I see we only have one more in the queue. So operator, could you put through the final question, please?
Our final question for today comes from Tahariri Sarozan of CBC. Your line is open.
Hi, this question is for Dr. Hinshaw. The Calgary zone has seen a high volume of online referrals, thousands of people requesting tests. What's being done to deal with the demand, and does the volume of referrals pose a risk?
So when you say the volume of referrals, are you meaning that someone has advised someone to get tested, or are you just meaning the volume of people who are voluntarily signing up for testing?
Of people, and whether, it could create a backlog and whether that could pose a risk.
All right, thank you. So with respect to the volume, it's something that I'm aware of, and we have been having conversations with Alberta Health Services about the importance of timely access to testing and the turnaround time from testing to results. It's something that Alberta Health Services is working on, and particularly prioritizing people who either have symptoms or those who are close contacts of confirmed cases, as we know from our data that those are the groups that have the highest proportion or the highest likelihood to have a positive test. So some of the algorithms that are in place behind the online testing requests do attempt to give people who have symptoms priority, which is really important that we do that. So that's something that is built in, and we are working with Alberta Health Services to see if we can find other ways to enhance the speed with which people can have access to testing.
All right, thank you for joining us, everyone. We'll provide another update on Thursday afternoon.